Stress, unfortunately, is a part of life. We can't avoid it, from family to work and our finances. It all can have a negative impact on our health without us even knowing it.
Our medical expert, Dr. Payal Kohli, is here to tell us more about the risks stress is having on our hearts. Why does stress evolve? Stress, does it ever serve us, or is it just there to take us down?
No, it's protective, believe it or not. That's a hard one for me to believe because I tend to have a lot of stress. But you think about pain, it was a protective mechanism. You think about stress, you see a lion or a tiger, fight or flight, run away, right? And then when you're not doing that, you're rest or relaxation. Now we have metaphorical tigers everywhere in our lives. Our finances, obviously, as we talked about, our health, our kids, our work, what we're watching on TV. So now we've got chronic activation of that fight or flight response, and all it's doing is damage.
I believe that. And, you know, financial stress to me is something that will keep me up at night.
Yes.
There's a new study I know that you wanted to talk about, that there is a link between financial stress and your heart health. What is that?
This was shocking to me because I'm not regularly asking my patients about their financial health, but they took 280,000 patients from the Mayo Clinic and they looked at their EKG, which is an electrical map of their heart. So it actually tells you about the structure of their heart, how their heart is behaving and aging. And they saw that those that had the most financial stress, just on a survey, self-reported, had a 60% higher faster aging, essentially. Right. And this was even more than traditional risk factors like high blood pressure, high cholesterol, the things that we normally look for and screen for. So to me, this was a huge eye-opener that the things that are around us, these social determinants of health, we're not giving enough credit to. And this is why heart disease is such a #1 killer, because all these things are happening to us and we don't even assess them, much less interrupt them.
Mm-hmm. Are all stresses, I guess, the same? I mean, I feel like especially what we do, we cover in the news, and it's for everybody, our viewers, who have to, you know, want to be informed on what's going on around them. You watch the news and it's tough. It can take a lot out of you.
So if you think about stress, I want you guys to think about the dose, the duration, and how long it's sort of activated. And that's really how you want to think about it. So somebody butts in front of you while you're driving, you get that fight or flight response, you get that adrenaline rush.
That honk your horn.
You honk your horn.
I do.
And road rage.
Expletives.
Okay, but then a minute later it's gone, right? So that's a quick little peak and it doesn't go necessarily too high. Our body is designed for that kind of stress. That is not damaging. But when we're sitting there watching that same video of somebody being killed in the street over and over again, we're activating that fight or flight, especially right before bedtime. When we're worrying about our finances, Sam, you mentioned obviously that the stress itself, the stress hormones, but we're not sleeping, we're not eating. That's a chronic activation of stress. You're talking about a higher peak and a longer duration. That's where we start to have maladaptive effects on our body.
And you mentioned stress hormones. So is that the main cause of stress? Is there a way to mitigate said stress hormones?
So it literally opens the door for all the bad biological functions. So I want you to think about it like a domino effect, and the adrenaline, the noradrenaline, the cortisol, all those hormones get activated, especially chronically, and they start to cause those other dominoes to fall. So like I said, you're not sleeping. If you have financial stress, you're not just worrying about money, you're worrying about food. So you're not eating well, perhaps eating more processed food. You're not accessing medical care either. Forget about time for leisure and exercise. You're too busy worrying about making money. So these types of things in our lives, whether it's scrolling social media, whether it's financial stress, they take away from other things in our life that are also helpful. So it's not just the damage that they're doing directly with the hormones and the lack of sleep and the food, but it's also the indirect damage of how they're affecting the way that we behave and the way we interact with each other.
Before we let you go, when is that point where it's not just like the stressors of being alive, being a mother, being a wife, you know, in 2026, but this is something that is actually affecting my heart? What should I be telling my doctor, or when do I go see a doctor?
So I would say if it's affecting your sleep, your eating, your socializing, or you've got this narrative in your head, as many of us do, constantly a running narrative of what to do, it's time to really go talk to your doctor. Because one little peak of stress when somebody cuts you off in traffic, normal, healthy, some stress is actually healthy. We evolved to have stress. We're never going to be stress-free. But if it's turned on all the time or the volume is turned up too much, it can really be maladaptive. And I've started adopting some strategies for myself. I want you guys to try. Report back to me. No cell phone on your nightstand, if you can do it.
Oh, that is impossible.
Yeah.
No.
Mine's
Just
there.
old-fashioned alarm clock so that you have at least 15 minutes after you wake up before you reach over.
Okay.
I want you to journal your stress with a score every day from 1 to 10. because that
I'm stressed out
increases,
hearing this,
To
this
the
homework
tins,
assignment.
this increases your awareness of your stress, and then you can start to adapt intervention. So just try those two things for the next month and see what that does to that volume of that stress.
Good advice.
We can do that.
Done.
Okay.
Dr.
Dr.
Kohli.
Kohli.
Thanks.